Hi everyone, welcome back. Nice seeing you again. Today I'll be discussing how to get pregnant faster with ovarian cyst. In this video I'll start with what is ovarian cyst, how this ovarian cyst forms, what are the types of ovarian cyst, and how they can affect pregnancy, when to be worried if you have an ovarian cyst and when not to be worried, and peradventure any of the cyst is affecting pregnancy or getting pregnant, what to do about it. If you are interested in this, please you can stay tuned. My name is Dr. Kiruka Bridget at OBGYN Talks with Dr. Adazion. I discuss everything on women's health, children's health, and sometimes men's health. So if you are interested, please subscribe to my page now. Follow me on Facebook, TikTok, and on Instagram with the same name, OBGYN Talks with Dr. Adazion. So what is ovarian cyst? Ovarian cysts are fluid-filled sac seen within the ovary or on the ovary. They are just like a sac that are filled with fluids, and they can be on the ovary or just within the ovary. Ovarian cysts can naturally occur because of ovulation and menstrual cycle. So they are very common, and most women at one point or the other in their reproductive stage will have or experience some form of ovarian cyst because of the menstrual cycle, the ovulations, and the hormones associated with it. Most of the ovarian cyst does not affect pregnancy. They can grow larger to a point that they may cause some discomfort, some pains. However, some ovarian cysts may affect pregnancy. So how does ovarian cyst form? In a woman's reproductive life, their menstrual cycle, and from one menses to another is known as one menstrual cycle length. So when a woman just finishes seeing her period, that's the beginning of her menstrual cycle, that stage before the ovulation is called the follicular phase. At the follicular phase, the ovaries begin to grow some tiny cysts, tiny ovaries filled with cysts. These eggs are filled with cysts, and at a point the brain senses and releases follicle stimulating hormone. That follicle stimulating hormone causes one of the eggs produced to become the dominant follicle, and they begin to grow, filled also with cyst. And as this egg is growing, other hormones are being formed like estrogen, and at a point when it's matured, it senses the brain to produce another hormone known as luteinizing hormone. This luteinizing hormone will cause a rupture of that egg that has been forming in the ovary, and it will become the dominant follicles now rupture. When the egg is released, then the cyst remaining seals up and turns to another more semi-solid cyst known as the theca cyst. This theca cyst is what sustains pregnancy because it releases another type of hormone called progesterone. Peradventure, the egg released is fertilized and pregnancy occurs. It will now go on to sustain the pregnancy until about 3 months when the placenta will take over. So theca cyst is another form of cyst that comes from the follicular cyst, which is produced from ovulation, and this one sustains pregnancy. So you can see this type of cyst is helpful in pregnancy. It will continue to sustain the pregnancy until about 3 months when placenta takes over. If the woman does not get pregnant or the egg is not fertilized, what happens is that at a point about 2 weeks, that's 14 days after your ovulation, that theca cyst dies off, the progesterone is withdrawn, and the woman goes on to see her period. Now this is the functional cyst. So functional cyst, when the level or the growth is between 3 to 5 cm, there is no problem, because most of women and every woman in their reproductive cycle will see this cyst. However, if this cyst continues to grow and does not regress and continues to grow, the level may be above 5 cm, and at that time we begin to get worried. So we'll monitor the individual in the next cycle and watch if that cycle is growing. If the cyst rather is growing, if the cyst continues to grow and it gets to about 8 cm, we try as much as possible to see if we take over the next menstrual cycle with the use of combined oral contraceptive. So you give it to prevent ovulation, because the more she ovulates, the more the cyst form. So we hope that with that, taking over the ovulation, the cyst will regress, and the next cycle following after taking over the ovulation, the woman will go on to have her normal cycle length, the normal functional cyst, and the size, which will grow and regress. These ones are okay. Now we have other forms of cyst. We have the one that we have types of cyst. We have the functional cyst, just like I've mentioned. We have the endometrioma. We call it chocolate cyst. This one follows from endometriosis. I've discussed endometriosis in my previous video. For people that have the endometrial lining or endometrial tissue or stroma from the endometrium implanted in other parts of the body, if they're implanted in the on the ovary, they'll continue every time the woman sees that period, the same implantation in the ovary will bleed, and after bleeding, those bleeding is in an enclosed area, will form a cyst. So it's called chocolate cyst. This type of cyst can actually affect pregnancy, can affect the person from ovulating, and can affect the person from getting pregnant. We have other ones, other cysts, like dermoid cyst. Dermoid cyst is a form of cyst that has hairs, teeth, fat, or even nails. We see it in this cyst on the ovary enclosed. Most times they do not give any issue, but if they grow bigger, it may affect ovulation and may affect the person from getting pregnant, but most times they are quiet on their own. Then we have other forms like cystal adenoma. These are forms of endometrial cancer.
These are forms of benign endometrial cyst.
It
Maybe
may affect the
CA.
person's reproductive life, the person's life as a whole. So ovarian cyst can only be detected, apart from the symptoms it presents. If they are still tiny, they can just be detected with ultrasound. So these are the types of ovarian cyst. Functional cysts are normal. However, they may present with discomfort when the level is above 8 centimeters. They can present with discomfort on the side where the cyst is. They may grow bigger in size, and because they have grown bigger in size, they may have a stalk, and they may toss on each other. And when it tosses on each other, it may affect the person's even ability to have sexual intercourse to get pregnant. So when they grow bigger and start giving somebody discomfort and start giving symptoms of that they have tossed on themselves, that they have twisted, or that they have bled into the cyst, we'll try as much as possible to remove it. If it's on its own, we'll just go enucleate the cyst, and the person goes on to live a reproductive life and get pregnant. If it's in the ovary and that ovary cannot be salvaged, we'll just take out the ovary and the person gets pregnant with the other ovary. However, most functional cyst does not affect fertility. Most functional cyst does not affect pregnancy. Luteal cyst is the one that helps the woman when she gets pregnant to sustain pregnancy to 3 months. When you have endometriomas, that is chocolate cyst, the one that comes from endometriosis, and they are on the ovaries, this may affect pregnancy, and you may have to do laparoscopic surgery to remove the cyst as much as possible, because when it's on the ovary, it may cut the surface of the ovary and the person may not be able to get pregnant. So when you have chocolate cyst on the ovary or in the ovary, try as much as possible laparoscopically, that is minimal access surgery, they can be removed. Those chocolate cysts can be removed and ovulation will occur. If ovulation does not occur, you have to induce the person's ovulation and using ovulation induction drugs and allow the person to get pregnant. In cases of dermoid cyst, the one that has nails, hairs, even fats, those ones can, even teeth, you can see teeth in dermoid cyst. Those ones, when they are small, they may not give any symptom, just allow it. And most times it's during other surgeries that you see it and just remove it. However, if it becomes so big, distorting the ovaries, causing twisting, you can go on to remove it, and the woman goes on to get pregnant and have her babies. It
can be a benign lesion, so surgery can be done. Surgeries can help to heal the woman.
Of ovarian cyst, their types, and how someone can have ovarian cyst and get pregnant. So in conclusion, ovarian cyst most ovarian cysts are functional cysts and they do not affect pregnancy. However, when it becomes so massive, giving the person symptoms, even in pregnancy, you can still go on to remove the ovarian cyst and the pregnancy survives. The person goes on to have her babies and have her pregnancy. So thank you for watching to this point. I try as much as possible to keep it slow for everybody to understand. If you have any question, drop it on the comment section. Follow my page, share the video, drop a like, and see you next time. My name is Dr. Adazion. At OB/GYN Talks with Dr. Adazion, I discuss everything about women's health, children's health, and sometimes men's health on my page. See you next time for another enriching, beautiful video. Thank you.